Have you ever wondered why you wake up several times at night to urinate, worried it might be a sign of something serious like cancer? What if I told you there's a common condition that could be the culprit, and not as frightening as you might think? Stay tuned as we uncover the truth about an enlarged prostate, also known as benign prostatic hyperplasia, or BPH. BPH is a common condition where the prostate gland enlarges over time, leading to restricted urine flow. To understand it better, let's hear from Dr. Scott Cheney, a Mayo Clinic urologist.
I like to tell patients that the prostate is kind of like an orange with a straw going right through the middle of it. As we age, the prostate gets larger and larger, compressing the urethra, the straw, making it harder for the bladder to push urine through.
There's something I want to share with you. Something that can be incredibly helpful for maintaining prostate health. It's called a prostate checker, and it's not what you think. I'll explain what it is and how it works a bit later, but trust me, you'll want to know about this. As Dr. Cheney mentioned, the prostate is situated just below the bladder and surrounds the upper part of the urethra, which is responsible for draining urine from the bladder. The prostate's primary function is to aid in the reproductive process and fertilization. So what happens when the prostate enlarges? As it grows, it starts to squeeze the urethra, making it difficult for urine to pass through. This can lead to symptoms like frequent urination, especially at night, a weak urine stream, and difficulty starting and stopping urination. Enlargement of the prostate gland can give rise to uncomfortable urinary symptoms, including the obstruction of urine flow from the bladder, causing individuals to strain more to urinate.
BPH does not mean cancer. It is truly just enlargement, and the cells in the prostate are not cancerous. Prostate enlargement is much more common than prostate cancer.
An enlarged prostate can cause troublesome symptoms and affect the quality of a person's life.
It's a big quality of life issue for men. I think a lot of men ignore their symptoms for a long time because we don't like to complain or think it is a normal part of aging, but in reality, it's so common, and there are multiple ways that we can treat prostate enlargement and symptoms associated with it.
Symptoms of an enlarged prostate include frequent or urgent need to urinate, urinating more often at night, trouble starting to urinate, weak urine stream, a stream that stops and starts dribbling at the end of urination, and not being able to empty the bladder fully. So you've heard me talk about the prostate checker, but what exactly is it? The first component of the risk assessment tool, prostate checker, utilizes resources like online risk assessment tools. For example, the Cleveland Clinic offers a prostate cancer risk assessment. You can find the link to this tool and others in the description below. Have you ever tried a prostate cancer checker before? Let us know in the comments. This type of tool asks questions about your age, family history, lifestyle, and other factors to give you an idea of your individual risk level. It's a great way to become more informed and identify areas where you might need to focus more attention. Please remember, these tools are not a substitute for professional medical advice. Finally, the prostate checker also includes adopting a healthy lifestyle. This means eating a balanced diet, rich in fruits, vegetables, and whole grains, and limiting red meat and processed foods. Regular exercise, maintaining a healthy weight, and managing stress are also important for prostate health. By combining self-awareness, regular medical checkups, and healthy lifestyle choices, you can create a comprehensive prostate checker plan that works best for you. If you're experiencing any of these symptoms, it's important to talk to your healthcare provider. BPH is a common condition, but it can be managed with the right treatment.
Treatment can be something as simple as taking a well-tolerated medication that helps to open that channel through the prostate that can relieve symptoms, all the way up to surgery where we remove the obstructing tissue of the prostate to leave men with a more wide-open channel and better emptying.
There are various treatment options available, including lifestyle changes, medications, and in some cases, surgery.
Here's how I like to think about treatment of prostate enlargement. The first thing that you can do is lifestyle modifications, which take no medicine and are low risk. Avoid excess fluids, especially before bed, and be mindful of the types of fluids you consume. Caffeine and alcohol, especially before bed, can worsen nighttime issues. Simple lifestyle tweaks can help men significantly and improve their symptoms.
Medications like alpha blockers and 5-alpha reductase inhibitors can help relax the muscles in the prostate and reduce its size. However, if medications are not effective, surgical options may be recommended.
Less invasive surgical options include Rhizome, Urolift, and iTind. More definitive options would be transurethral resection of the prostate, or TURP, or holmium laser enucleation of the prostate. Working with your healthcare team to determine the best option is essential.
Remember, it's essential to have an open and honest conversation with your healthcare provider about your symptoms and treatment options. Early intervention can greatly improve your quality of life.
It's sad to know that men are suffering out there and don't want to complain. They don't want to bring it up. It's embarrassing to admit that there's a problem there. But there are many wonderful, effective solutions to treat prostate enlargement.
Thanks for watching today's video on benign prostatic hyperplasia. If you found this information helpful, give it a thumbs up and subscribe to your channel name for more health-related content. And don't forget to hit the notification bell so you never miss an update. Take care and see you in the next video.